Very good morning all. Today I will discuss about the various softwares used in 3D digital imaging and image guided implant placement. Now coming to interactive simulation software programs. Most useful and valuable advantage of using digital imaging is use of these specialized software programs which enables to design the treatment plan by the interactive communication among the implant team. So implant treatment planning is greatly enhanced by the use of these specialized softwares. In addition to measuring the quantity and the quality of the bone in potential implant site, with the help of these software programs, we can simulate the placement of implant and restoration or prosthesis from the scanned data. Using the database of commercially available implant images, the length, width, angulation and position of implants can be simulated in a desired position and evaluated with the relative to other structures in 3 dimensions. In case of alveolar ridge deficiency or any defects or when sinus bone augmentation is indicated, the additional bone volume needed can also be evaluated and quantified. The restoration of implant can also be simulated along with the distribution of the mechanical forces onto the implant and also on the adjacent bone. These also can be predicted with these softwares. Now moving to the software programs and how they are useful in implantology. Various software programs are available such as Implant, Vivo5 Planning, Prixion software, etc. These can be made available to the user either by direct purchase or innovative per use license from various vendors. In Implant softwares, it allows to reformat the scan image as a data files. Whereas in Vivo5 Planning and Prixion software programs, the data can be scanned as a DICOM files where there is no need of reformatting the images. These techniques enables the radiologist to transfer the imaging study to the clinician as a computer files and enables the clinician to view and interact on their own computers as diagnostic radiologic workstation. Some of the techniques has the ability to place the implant virtually and construct the precise guide splint and final prosthesis which would be delivered after the implant placement following the flapless surgery. You can see the images for Implant software in panoramic, axial and cross-sectional view as on the image slide, where scan data can be reformatted and interactively changed in any direction. During the diagnostic evaluation by these softwares, where clinician can measure the length, width and depth of the alveolus, can also measure the bone quality and change the level of the grayscale to enhance the perception of critical structures. Regions of the patient's anatomy can be selected for display normally or it can be magnified or with a number of grayscale prediction facilitating the appreciation of the anatomical structures or disease. Now I shall discuss about how does image guided implant placement works in actual and how does it helpful in implant dentistry. An important feature of interactive imaging software program is that the clinician and radiologist can perform electronic surgery by selecting and placing arbitrary side cylinders that simulates root form of implants in the images to develop the patient's treatment plan in 3 dimensions. With an appropriately designed diagnostic implants, electronic surgery can be performed electronically in 3 dimensions and can be accurately determine bone quality, angulation and orientation of implant site, better appreciate the relationship to the critical structures before surgery, which in turn helps to avoid any sort of post-operative complications and so decrease the failure rate of the implant. In some research studies, use of imaging stunt which helps to relate the radiographic images and its information to the potential implant site and are used as a surgical guide to orient the insertion angle of a guide burr and the implant angle was evaluated. Scan appliances used for the fabrication of surgical stents are by using the computer aided design or computer aided manufacturing, that is CAD/CAM, such as stereolithographic rapid prototyping are used to build or construct the surgical guides to aid in the precision of implant placement during the surgery. Certain limitations of this includes Electronic surgery enables placement of the electronic implant in the imaging study, but the refinement and the exact relative orientation to the implant position is difficult and it makes the cumbersome. In practical, the precision and accuracy of the treatment plan at the time of surgery is a major challenge. Further, more clinical studies needed to clarify certain issues. Now, I shall discuss something called digital subtraction radiography and how it is beneficial or useful to implant dentistry. Once the implant process is done in a patient after the complete diagnostic evaluation, clinician is faced with a new diagnostic concern to determine the success or failure of the implant placement procedure. Detecting initial saucerization or formation of an angular bone defect around the implant is very difficult on these radiographs. In addition, because of the sharp contrast between the bone and the implant surface, spreading the bone loss along the threads of the root form type of implant is often more difficult to visualize. Digital subtraction radiography, however, has been applied to post-operative evaluation of implant to address these problems associated with detecting the changes with the radiograph. With the use of this, a computer digitizes and manipulates the radiographic images to subtract or remove the unwanted distracting background detail between the two preoperative and postoperative images to produce a clear image. This is how the digital subtraction radiography is useful for the implant dentistry for postoperative evaluation. To conclude with, today's clinician has a wide array of diagnostic tools at his disposal. The CBCT gives the best information of the available imaging modalities. More commonly, though a combination of intraoral periapical and panoramic radiograph are used. To date, no modality has been deemed to be perfect. So, the clinician has to carefully weigh the pros and cons or risk to benefit ratio of each imaging modalities. The future for the further development of imaging techniques specific for the application in implantology is it bright. We can definitely expect much more accurate, faster and safer modalities at a low cost to come into the field soon. Thank you.